we learned about the difference between heart attack and cardiac arrest. So today we're going to learn about heart attack versus panic attack. So a friend of mine was locked up in a car and she panicked. And after the whole episode, she rang me and said, "Oh, I had a heart attack." I said, "You had a heart attack? So what happened?" She said, "I was locked up in a car and then I had a heart attack." I said, "No, that's not heart attack. That was panic attack." So panic attack or anxiety attack. So let's try to differentiate between panic attack and heart attack. Have you had panic attack before? All of us, I promise you, all of us at some point have experienced panic attack. Especially if you have been served breakfast. Niger people will understand this. If you have experienced breakfast, like if you have been dumped or if you have been, whatever, you have experienced, so that whatever you're feeling in your chest, that thing happening within you is a panic attack, not heart attack. Okay, so let's try to trace the difference between anxiety or panic attack versus heart attack. Number one, let's look at their causes. What causes heart attack? Like we explained in the previous video, heart attack is caused by blocked blood flow. So when there is blockage of blood flow to the heart, then heart attack will occur, and it's a medical emergency. If that happens, please dial 999 or 111. But if you are in a country where there is no emergency to call, please rush that person to hospital. And then the cause of panic attack or anxiety attack is triggered by anxiety, by fear, or by stress. So whatever that can cause you so much anxiety, so much fear or stress can cause panic attack. For example, people who are claustrophobic. Some people, when they are in a crowd, so they feel like fainting. When they are like in lifts, or people like I said, my friend that was locked up in a car. So when they are in an enclosed space, so that thing you're experiencing is panic attack, not heart attack. So causes triggered by anxiety, fear, or stress, that is panic attack. Number two, so we're tracing the difference between these two. Number two, pain location. Remember, when you have this attack, there is pain on your chest, but where is the position of this pain? For heart attack, the pain location is on the center of your chest or towards the left of your chest, and then from the left of your chest, it can migrate to the left side, and sometimes to your arm, to your jaw, to your neck, and to your back. That's why when you go to hospital and you're telling your doctor, "I'm having chest pain," the first thing they will tell you, is it moving towards your left? Is it going up to the jaw, to your neck? And if you say yes to those things, then someone is suspecting heart attack, and probably it helps in diagnosing a heart attack. Now, pain location on panic attack, so it can be on the center, it can be on the left, but sometimes it changes position. So sometimes it can be here. It's just that you're experiencing that pain somewhere on your chest. So that's the difference. Number three, pain type. What's the type of pain you experience? In heart attack, the pain type is like a pressure. It's like you're carrying a heavy weight on your chest. Okay, so sometimes it's like a squeezy. Your chest is like squeezing, heavy. It's just like you're carrying a heavy load on your chest. That you'll experience in heart attack. But in panic attack, the pain can be sharp or stabbing, but often also it changes position. So that's the difference. Number four, breathing. How is your breathing when you're experiencing this attack? In heart attack, there is shortness of breath, SOB. There is shortness of breath, and always faster, and not always fast, and not the panicky breathing. So in heart attack, somebody can be, having shortness of breath. You could see but it's not the panicky one. Unlike in panic attack, the breathing is fast, shallow, and it's called, like hyperventilation. So sometimes in panic attack or anxiety attack, imagine yourself being locked up in a small space and you're claustrophobic. You see the person breathing this way. You are hyperventilating. You're not bringing in too much oxygen into you because you're hyperventilating. You're just doing that, but not enough oxygen is going in. That you will experience in panic attack. But this one is not necessarily like that. 5, duration. So the duration of heart attack could be anything about 30 minutes or more. However, it does not improve with rest. So if you want, lie down there. You may lie down there, rest for 1 hour. It might still be there. It might go and come back, but it doesn't improve with rest. However, in panic attack can peak at 10 to 20 minutes. So if you can calm down, if you can maintain within maybe 10, 20 minutes, reassure yourself and do all those things, it might go away on its own, maybe after 10 to 20 minutes. But heart attack, it doesn't go away. Now, number 6, other symptoms. Let's look at other symptoms. There might be nausea, vomiting, dizziness, fatigue, cold. So you're in heart attack, so you feel like vomiting. Sometimes you vomit, you're very tired. There could be cold sweats on your body, and sometimes you feel like, a little bit dizzy as well. So that you can experience in heart attack. But in anxiety, you will sweat. What I say? I said there is sweat from South Africa. Okay, I'm not sure if South Africa is that hot, okay? So there is sweating, there is trembling. That is the difference. There is trembling in this one, and sometimes you feel choking, fear of dying, and sometimes you feel like going crazy. Ask someone who has experienced severe heartbreak. That's what I call breakfast, right? That's what we call breakfast. So someone who has shock. When someone who has maybe someone served you breakfast, or you have claustrophobia. I'm just using this claustrophobia because my friend experienced it, so that's why I'm saying that. So there is this trembling. You are afraid. You are scared of, you just feel like you're going to pass away and all that. So that you will experience in panic attack. At 7, we're looking at response to activity. Often in heart attack, when you move around, when you walk to toilets, when you do some things, the heart will race more. So you might have the attack. So it's triggered by maybe physical efforts when you're walking and all that. You experience that in heart attack. But in panic attack, it can happen when you're at rest. That all of us know. If you have experienced heartbreak before, if someone has locked you up, if you have been in a crowd and you feel like fainting, you feel like dying, that is panic attack you're having. Number 8, let's look at their recovery. In heart attack, if it's not treated quickly, there may be a permanent damage to the body, or the person dies. But in panic attack, there is full recovery after the person calms down. So usually there's no body damage. Body damage can come in, maybe, for example, when my friend was in the car. So if she had decided to break the glasses and jump out or something, or get fresh air or shout for help, then you could sustain some bruises there. So that is maybe related to your action. But ordinarily, when you calm down, then there's usually no damage to the body. So the 9th one we have here is treatment. So how do we treat these 2 attacks? For the heart attack, the treatment is oxygen. So you see why whoever that is experiencing heart attack should please take yourself to hospital. And remember, it's a medical emergency. If there's no 999 or 111 to call, please just get the next available car and take yourself to the hospital, because the treatment includes Oxygen. You need some oxygen. You need some aspirin. You know, some people will tell you if you think you're having heart attack, take aspirin, put it in your mouth and chew it. Okay, but that's if you know you're not allergic to aspirin, because if you have severe allergy to aspirin, you'll be dealing with two things. So always try and find out if you're allergic to anything. But aspirin is part of the treatment. ECG in the hospital, you have to get some ECG. They will do ECG on you to see how the heart is racing. There will also be some blood tests, and sometimes it will end up in surgery. 9, anxiety. Under anxiety, all you need is calming techniques. Sometimes breathing exercise. You know, when they will tell you to breathe some deep breathing, and it's a psychological thing sometimes. So just keep reassuring yourself, I'm okay, I'm fine, I'm okay, I'll be fine, I'm fine. So you know the calming techniques. You know, people that do yoga and all those mind exercise and all that. So if you can apply them, it will help you here. And also, you might need some anti-anxiety medication. Some people are on anti-anxiety medication and it does help. So guys, I hope this will help to teach us the difference between heart attack and panic attack. So when they serve you breakfast, when you are in a closed place and you have phobia for it, so when you have any of these, it is panic attack or anxiety attack, not heart attack. If heart attack happened to that my friend, she won't be calling me in the next 30 minutes and said I have heart attack. Maybe a relative of her might be calling me to say, oh, your friend is in the hospital. So but we don't wish that to anybody, but it's just for us to know. Thank you for watching me. This is Etta, and I will see you in my next video. Have you followed me? Follow me at